COVID-19 have been greatly reduced by this treatment or significantly reduced by this treatment, they're still far too high.
One of our regular medical experts joins us once again from Houston, Dr. Michael Chang, an infectious diseases specialist at the University of Texas's Health Science Center. Great to see you again, Michael. Tell us about what you know of this drug.
Yeah, fortunately, dexamethasone, as you pointed out, is widely available. It's been used for many conditions prior to COVID-19 and this new coronavirus. We have a long history of using it for other diseases, and so there's a lot of experience with using dexamethasone. I think it was great that this study demonstrated the 30% reduction in deaths in patients on mechanical ventilation or requiring, breathing help. I think that's a big news, and I think that's great evidence. I think providers across the globe have been using dexamethasone kind of, off-label, so to speak, for treating patients with coronavirus already. But it's nice to have this trial actually confirm the experience and the use of dexamethasone to treat patients with severe COVID-19 disease.
It's just one of many drugs, I understand, that is being trialed around the world to treat COVID-19 patients. There's, of course, a difference between the drugs that reduce the amount of time, like remdesivir, of patients and the time they spend in intensive care, compared to this one that we're talking about, which actually increases the chance that if you have COVID-19, you'll actually survive it. Which other drugs are showing promise?
Well, the convalescent plasma treatments, where you take antibodies from people who have recovered from COVID-19, you take blood donation from them, and then you take their antibodies against COVID-19 from their plasma, and we give it to patients who also have severe disease. That seems to be showing a lot of promise. It seems to be getting anecdotally good results across the globe. And so I think that's going to be promising. This dexamethasone was definitely going to be helpful. And then, of course, there's a lot of other medications that are being tested. But I think certainly between remdesivir, convalescent plasma, and now the finding of dexamethasone reducing mortality, I think those are three strong tools that we have to help patients with COVID-19.
Michael, if you don't mind, I'd like to return to an argument that I put to a lot of our medical experts, because it's becoming more and more apparent, and I'd like to get your take on how COVID-19 becoming apparent that it's a multi-organ disease, and how it's going to affect the long-term health of those who contract the disease. What do you know about that?
Yeah, no, you're right. There's definitely evidence that COVID-19 or the novel coronavirus, SARS-CoV-2, can affect organs other than just the lungs. We've seen patients with heart failure, kidney problems, liver problems. So I think the patients who are having very severe disease with a lot of inflammation and a lot of multi-system injury, I think there's going to be a long road to recovery for them. And even the initial data for patients who are in the ICU, they're taking longer to recover than with other infections. But it is important to keep in mind, we're only a few months into this pandemic. So every day is a new day where we're learning new information. I hope these patients don't have a lot of long-term consequences, but unfortunately, we're kind of finding out as we go.
Michael, thank you so much indeed. Michael Chang speaking to us from Texas.